Hello, welcome to the PARS Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about orthopedic surgery rehabilitation. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. First of all, let's explain what orthopedic rehabilitation is. Orthopedic rehabilitation is part of a therapeutic program after surgery or illness which helps the body to speed up recovery time. It aims to make musculoskeletal functions more proper and decrease their limitations which cause pain in people who had orthopedic surgeries. The musculoskeletal system includes bones and joints, muscles, tendons, ligaments, and cartilage. Any orthopedic surgery is related at least to one part of this system, and rehabilitation can work on any of them. Several kinds of orthopedic surgeries and injuries could need rehab programs such as broken bones, knee or shoulder replacement, osteoporosis, arthritis, etc. Rehab programs may use assistive devices or not help your musculoskeletal system to recover quicker and better. Orthopedic rehabilitation is various according to everyone's body condition, purposes, and abilities. Doctors and physiotherapists should make a personalized therapy program for each patient which fits his/her condition perfectly and be according to patient purposes. The first thing you should do is to visit several doctors to determine the exact problem of your musculoskeletal system. Doctors should also determine the extent of your injury or your illness. Your problem may improve without surgery, but some cases need urgent surgery to prevent more and more injuries. So, this is totally up to you and your health condition. There are two kinds of rehabilitation, inpatient rehab and outpatient rehab. An inpatient rehab program is when the patient stays in the facility which the healthcare team provided for him/her and gives all the care the patient needs. In this kind of program, you must stay in a facility like a hospital or a clinic until your healthcare team recognizes your treatment should complete. In this situation, your treatment may differ from several days to months or more. It depends on your health issue and your injury, but mostly short-term rehab programs are inpatient unless the patient needs a special condition or specific equipment and facilities or skilled nurses. Outpatient rehab programs are the sort of rehab programs that are the treatments that are done through several therapy visits. For example, after your knee surgery, you should go to a physiotherapy clinic twice a week to practice walking and other movements which are related to your knee, with an expert physiotherapist that can help you with or without special equipment to recover faster. In most cases, patients should do some determining activities and practices by therapists at home between the physiotherapy sessions. Generally, complex injuries or problems need inpatient rehabs, and outpatients rehabs are suggested for minor issues. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Different types of orthopedic rehabilitation therapies. A skillful and expert healthcare team should include doctors, nurses, physical and occupational therapists to arrange the best possible rehab program for the patient. Musculoskeletal is a very sensitive system that could have been damaged by even an accident. So, make sure about your rehab program quality. There are different kinds of rehab programs such as physical therapy, occupational therapy, hand therapy, etc. We will give you some information about the most that have been used and the effective ones. Immediately after orthopedic surgery, your life couldn't be exactly like what it was before. The success of your surgery is not just in the surgery room, it also depends on what you do during your recovery period. One of the best things you can do for yourself after orthopedic surgery is to take advantage of physical therapy. In the following, we will tell you some reasons why physical therapy is worth trying and spent on after surgery. What is physical therapy? Physical therapy is a guide through programs and exercises which help a patient to regain his/her mobility after surgery or injury as well as to decrease the patient's pain. Physical therapists are trainers who are trained to help and guide patients during therapy activities which differ from regular stretches to customized activities designated for a specific target in the patient's body, according to his/her injury. Physical therapy has various treatment activities such as stretching exercises, strengthening movements, joint mobilization or soft tissue rehab, etc. In this video, we want to talk about physical therapy's benefits after orthopedic surgery or injury. Reducing pain. Therapies for lessening pains are different. It could be strengthening exercises or an active exercise that releases endorphin, a painkiller hormone, in our body. Also, it could be a massage on the postoperative area which has become a stiff tissue. Massage can reduce its stiffness, and as a result, it reduces pain. A physical therapist may use ice for decreasing inflammation or heated pads for reducing pressure, pain, and tightness, but electrical equipment will be more effective in relieving the patient from pain. Restoring mobility. Most people who had orthopedic surgery can hardly move even an inch. They would have difficulties in doing their daily routines like walking, sitting, taking baths. Very limited mobility is a very common issue after an operation, and if you do not take it, or ignore its pain, it could become a bigger problem. In this situation, physical therapy will be the best choice to help the patient regain body mobility again. They will help you to make your soft tissue firmer, which makes you more flexible. In many cases, most of the patients need therapy devices like canes, braces, crutches, which gradually regain your range of motion. Improving balance and control. One of the most popular reasons that people are looking for physical therapies is balance issues. After intensive orthopedic surgery, having balance and moving freely could be difficult and challenging for most people who had the operation. It can even become difficult to walk or stand freely without falling. This may cause you to leave yourself stationary or at the risk of re-injury. Fortunately, there are physical therapies that could help you a lot. With all tools and equipment you need for regaining your balance, and therapy programs that provide you a safe condition to practice and improve your balance. With an expert and caring therapist, after several physical therapies, you can gradually stand on your feet confidently and balanced, without any risk of fall or re-injury. Rehabilitation and recovery. Rehabilitation may be after an intensive surgery or sports injuries. In both cases, pre- and post-surgery physiotherapy exercises could be extremely effective. For people who had orthopedic surgeries like joint replacement, etc., physical therapy would be the key to success. It speeds up recovery time as well as restores regular movements, prevents re-injury, improves blood circulation, which causes lessening in pain and inflammation, increases joint strength and muscles around it, and many other benefits. Therapy may last for several weeks, and maintaining it in the program is one of the most important parts of your healing process. Make sure your therapist is designated a personalized program specifically for your condition, injury, and your healing purpose. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.